Sloan Kettering, the Cleveland Clinic, Seattle Children's. Some of the best hospitals in this country are so famous, their names are recognized coast to coast. But tonight we are learning that some of these giants may be out of reach to some of the folks in these new ObamaCare networks. Trace Gallagher live in our West Coast newsroom to explain. Trace?
And Megan, the Affordable Care Act mandates quality care, but there's no definition or guidelines as to what quality care is, so it's up to the insurance companies to decide where you can and cannot go. For example, in Los Angeles, if you get your insurance on the California Exchange, you cannot go to Cedars-Sinai. In Minnesota, the Mayo Clinic is out, and in Seattle, the Children's Hospital is off limits. Listen.
Those non-unique services at Children's are more expensive. And if we included those in the network, it would mean higher rates for our customers on the health care coverage they have.
Seattle Children's Hospital says it's more expensive because it treats gravely ill children and even simple procedures are complicated. Children's Hospital is now suing the Washington Insurance Commissioner to get back into the exchange. Listen again.
There becomes a point when if you start denying access to care, that you can hurt children and children's health, and that's what we believe is at risk here.
And for the family of 4-year-old Declan McNulty, the Affordable Care Act is a problem. Declan is a severe hemophiliac, and they say Children's Hospital has been a lifesaver. Here's his mom.
If none of the marketplace plans have Children's as an in-network provider, we simply won't go to them. We'll choose to stay with our current provider, paying more than what we could be paying.
So the insurance companies say smaller networks mean lower premiums, leaving many to ask, why are so many people's premiums going up? Megan.
All right, Trace, thank you. Joining me now with more, Dr. Mark Siegel, a Fox News medical correspondent and part of our medical A team, and Deborah Berger, who is co-president of National Nurses and a registered nurse in California. Dr. Siegel, let me start with you on this. That's scary when you hear about kids who are actually getting treatment who now no longer can go to the hospitals that they've been going to because of this law.
Megan, the most important thing that health insurance does for us is when we're really sick. I mean, it's great to say you're not going to have a copay for a mammogram or a colonoscopy, but what we really need health insurance for is when we're really sick. And if we can't go to the best hospitals in the country, then quality of medical care by definition is going to go down. And Megan, I don't actually think it's simply non-unique services. As Trace Gallagher's excellent report just pointed out, it's also across the board quality of care. I would rather be in a great hospital like Massachusetts General or UCLA or Cedars-Sinai or Mayo if I have a tough illness. Community hospitals are great, but you go to the university hospitals for the best care, and if they're being shut out, that by definition is going to lead to a decreased quality care and ultimately a two-tiered system of medical care.
All right, so we've gotten the doctor's take. Let's get the nurse's take now. Deborah, your thoughts on this?
Well, the nurses over the entire country have been concerned about this health insurance reform. And it's not Obamacare or the Affordable Care Act that's limiting the choices. Let's be clear. These are the insurance companies that were left in charge of health care and wrote health care reform. So they're the ones that are actually limiting care and creating this big bureaucracy to deny our patients care.
Okay, but with all due respect, today, what people really care about is care being denied. Are their children not going to be able to get, because the report in the Washington Post today is that these major hospitals, because of the law, are not, they're not included. They're not in the network anymore.
Well, and that's because the insurance companies are the ones that are actually deciding whether they're going to offer their services on the health care exchange.
And what you're saying, Dr. Siegel, what Trace's report said was that they're deciding not to because they want to keep premiums low under Obamacare.
Exactly, because they're being hit by so many more regulations under Obamacare, and they have to cover everyone with pre-existing conditions. And that costs a lot of money, so they cut where they can. They cut fees to doctors, and they cut the number of hospitals. And by the way, Megan, if I have a patient that's going to get admitted to a hospital, let's be clear to our viewers, I can only admit to one hospital where I have admitting privileges. So if I see a patient and I want them to go to my hospital, but my hospital doesn't accept their insurance, guess what? They're going to be forced to change their doctor and go to a different hospital. I can only admit to one hospital.
Go ahead, Deborah.
Right, but that's not the Obamacare or the Affordable Care Act that's making those decisions. It's the health insurance companies that are doing that. They're the ones that are
But here's my question for you,
to where
Deborah.
you can admit.
That sounds like splitting
Yeah.
hairs, because that's like saying the insurance companies made the decision to cancel these 5.5 million people and not Obamacare. But they did it because of Obamacare.
They did it so that they could reissue the standard benefits package to everyone.
But you're not being honest. Did they do it because of the law or didn't they? Did the law require them to up their standards to a level that Uncle Sam thought was appropriate, or didn't it?
They did.
Right. So that begs the question, Dr. Siegel. I mean, the people out there, for the purpose of this segment, this isn't about whether Obamacare caused it or what caused it. The point is, adults aren't going to be able to get into these hospitals that they want to go to, that are the top hospitals in the land, because they are excluded from the coverage being offered on the exchanges.
Megan, there's no free lunch.
But
If you're going to cover people with pre-existing conditions, with all kinds of illnesses, if you can go to the doctor whenever you want to, if you're going to have no co-pays, no deductibles, it's going to have to come out somewhere. The insurance companies, to preserve a profit, will cut the number of hospitals that they will refer you to. They'll say, I can't afford Seattle Children's Hospital.
We heard that in the piece.
And I'd rather have an appendectomy there, by the way. An appendectomy may be more expensive for a child at Seattle Children's. I'd rather have my kid have their appendectomy there. It's where everybody trains, top quality care in the country.
Go ahead, Deborah.
But the reality is that your choices for which hospital you could go to, even before the Affordable Care Act went through, was severely limited. Even in California, as a nurse, I know patients that were limited before the Affordable Care Act went through.
And now even more so. Listen, it's a good place to get sick, in between the doctor and the nurse. Thanks for being here.
Thanks, Megan.
And thanks for all you do.
Thank you. Thank you for inviting me.
For all the unwell people out there.